All right, so now we're going to hear from two other subgroups, best practices for volunteer firefighters and fire investigators.
Hi, good afternoon. I'm going to be talking about best practices for volunteer firefighters. Let's look at the greatest hits impacting the health and safety of all firefighters. There are exposures that they have at the scene. There are toxic exposures from fires, and also lifestyle factors that can impact both the exposures that they've had, as well as overall lifestyle and overall health. So there are a number of health conditions that one can see from this slide, from heart disease to reproductive health outcomes. And it's important to think about how all of these exposures may impact. Now, if you notice, I'm wearing red. February is Heart Health Month, and we do need to think about the fact that many of the same risk factors for cancer are also risk factors for heart disease. And we know that sudden cardiac arrest is one of the top causes of line of duty injuries for firefighters. Recently, the 5th needs assessment for the U.S. Fire Service was done, and in the health and wellness chapter, what they did is they looked at the major needs of the fire service and compared it to what's actually being done. And these are consensus standards to be the most safe and effective workplaces. In terms of fitness and health programs, what the needs assessment found was that the majority of fire departments don't have programs to maintain firefighter fitness and health. The majority do not provide the NFPA 1582 compliant exams, and most don't have behavioral health programs. All of these can be critical for both cancer prevention and overall firefighter health. When we look at what programs are in existence, 2/3 of programs have infection control and PPE decontamination programs. Now, if we think about infection control, the bloodborne pathogen standard came into effect in around 1990, 1992. So 30 years later, 2/3 of fire departments are complying with the law and have effective programs. Only about half of the programs half of the fire departments have programs for toxic exposure tracking. Let's hope that it won't take another 10 or 20 years for the rest of the fire departments to begin to have these critical programs. And it's our hope that with all of the national and regional organizations, based on a lot of the great work that's being done right here in Miami, to the National Volunteer Fire Council and all the other organizations listed, that we will be impacting both toxic exposure tracking and also mitigation of cancer risks. When we think about the leading causes of death among US firefighters, based on the career firefighters study, the 3-city study that I'm sure you've heard about or will hear about, heart disease was actually number 1 by 1 percentage point over cancers. So over half of all firefighter deaths are due to either ischemic heart disease or any cancers. Now, when we look at the causes of death among career firefighters, we find that career firefighters, the death rate is 12% higher. What we see is when the number is above 1, then it's higher than would be expected for the US population. Heart disease, on the other hand, is slightly below 1, and that's likely due to what's called the healthy worker effect, meaning that firefighters in general have better overall health, at least when they start being a firefighter, than the average population. So we would expect there to be what's known as the healthy worker effect and less heart disease. Recently, the Lavender report, which is done by the NFCS, was updated, and they came up with 11 best practices for preventing firefighter cancer. I'd like to highlight one of them in my time talking to you today. The best practice number 9 is get an annual physical, because we know early detection is the key to survival. So how do we do this? If we talk about the standard in the NFPA 1582, There are a number of examinations that are being done, from physical to blood work to breathing tests to periodic chest x-ray, but there are also cancer screenings. These are critical. We know that you're all exposed to various carcinogens, and it's critical that you have these screening tests that can literally save your life. So the screening tests that are recommended include for skin cancer, colorectal cancer, prostate cancer, lung cancer if you meet certain criteria, as well as screening for testicular cancer, oral cancer, and for female firefighters for breast and cervical. There are no screening tests for bladder, thyroid, or brain cancer, or for uterine or ovarian cancer that have been found to be effective, but that doesn't mean that you shouldn't raise issues about the fact that you're a firefighter when you go to see your doctor if you're not getting an NFPA 1582, or even if you are getting one, make sure your physician is aware so they can keep an eye out for these other cancers. When we look at prostate cancer, we do know that prostate cancer does affect firefighters more, and it's critical that you discuss this with your doctor. Now, I've talked to you about what we know very briefly from the career firefighters. Now we're going to hear about a study that we did on volunteer firefighters.
So I'll introduce my boss, who is Dr. Jacqueline Moline. She's chair of Occupational Medicine, Epidemiology, and Prevention at Northwell Health in New York. Her other hat that she wears is she's chair of the Health and Wellness Committee for the Firefighters Association of the State of New York. FASNY, which is a 150-year-old organization, represents excuse me, the volunteer firefighters in New York. We're one of those states where the vast majority of our firefighters are volunteers. If the national average is around 70 in New York, it's about 94-95% for all volunteer and combination departments. And as the chair of their committee, in addition to doing lots of firefighter department physicals and fitness testing, she was privy to their struggles to get a presumptive cancer bill passed for volunteer firefighters. Brian McQueen, who you've heard about, was a director at FASNY, and he engaged her to advise them, like, what's the problem? And the problem among the legislators was always, what are the numbers? It's a numbers game. This is true in career fire, in states trying to get presumptive cancer legislation for career firefighters as well. How many cancers are we talking about? What are the risks? What is this going to cost? So they engaged Northwell Health, Jackie's department, to conduct the first all-volunteer fighter cancer study in the U.S. Miraculously, in the meantime, from the time we were engaged, early 2017, the bill passed. Both houses of the legislature, the governor signed the bill into law, and the presumptive cancer bill, gap coverage disability bill for New York State volunteer firefighters went into effect in January of 2019. But the FASNY organization decided that it was still worthwhile to conduct this study because of the lack of data on cancer risks in volunteer firefighters. Sorry, I should have advanced the slides. Okay, there we go. So this is the study that we collaborated on, as I mentioned. But let's think about some of the risk factors that may increase the risk for volunteers versus cause them to have possibly lower risks than career firefighters or the general population. On the right side are things that we believe potentially may lower their risk. Obviously, the majority of volunteers work in less urban environments, mostly rural and suburban, in fact. They probably do attend, and we have data that show that they do attend fewer fire incidents, particularly structural fires, spend fewer hours in the firehouse because of the nature of their duties. In terms of cigarette smoking and alcohol use, we're not sure. It's probably comparable. There is probably a healthy volunteer effect, but not nearly as strong as the healthy worker effect that causes career firefighters to have lower risk than the general population. But they do have day jobs. You know, they may have other occupational exposures that put them at increased risk, including, for many, current career firefighters or retired career firefighters. They're probably somewhat less fit, given the demands, and we know that they're older. They get less fireground training on protecting themselves, and due to budget constraints and other resource issues, they may have less effective PPE. So on balance, we're not sure. Would they have comparable cancer risks or lower? But the fires and the contaminants and the carcinogens don't ask if you're getting a paycheck when you go into the fire ground. They're all exposed as well. So we did attempt and did, with the cooperation of FASNY and the miraculous cooperation of many, many fire departments throughout the state. I should have mentioned that there are over 1,700 volunteer fire companies throughout the state of New York. And we're located down in Long Island, Nassau, Suffolk County area, where a large majority, we have over 180 fire companies in that area. We did a statewide outreach, and last year I presented some of the recruitment details and the challenges of doing this. There's no central registry for volunteer firefighters that we're aware of anyway. We tried a couple of other recruitment methods using state training records, but none of them had, even the membership rolls of the 45,000 FASNY members didn't have the data we needed to conduct the cancer registry linkage. We used the same study design as the NIASH study and the the Florida Professional Firefighter study to match personnel records to state cancer registry records. But we were able to engage 126 volunteer fire departments who submitted the personnel records with all the required information. We started with over 18,000 records, but needed to exclude various, over 4,000 for various reasons, missing data. And we ended up with a cohort of 14,800. And these are sort of the service details of the members of our cohort. Majority were identified as firefighter, as opposed to other. We did include EMS in the study, but for the most part, we got records for firefighters. 41% were active members, and most of them were not officer rank at the time of the study. And the average year of firefighter service was 17 years. And their average age of starting as a volunteer firefighter was 24 years of age. Again, some more characteristics. We excluded anyone born before 1900 because we didn't think they would be in the cancer registry, which started in 1976, and over 2/3 were born after 1960. The majority were male, but we did have over 11%, which is representative of the amount of female firefighters in the Florida professional studies and nationwide. The majority were white, non-Hispanic. So what did we find? So this study, this is a little bit of a busy slide, but it just compares what we found in our cohort of 14,800 to some of the other cohort studies, including the recent Florida career firefighter study. The only other all-volunteer study was done in Australia. In Australia, they have central registration of all firefighters, including volunteers. So they were able to study over 200,000 countrywide in their cohort. And then I included the Daniels study here for comparison. And our rate of cancer, our proportion of our cohort with cancer was 7.1% overall. It was about twice as high in men compared to women. And that is what's seen in most of the other cohorts, except for the NIASH study, which is represents an urban setting and an earlier time period for the most part. But our rate was pretty comparable to what you might see, slightly higher, but not statistically significantly higher than in the other cohorts. And this slide, it's a little busy, but I think you can see that these are ordered in the frequency of cancers in our cohort from highest to lowest, and like all the studies, and I've limited this to the male firefighters. We have it for female, but for many of the sites, there weren't enough to do calculations on. But for the men in the study, prostate cancer was just overwhelmingly the most common site, followed by lung cancer, melanoma, colon cancer, bladder cancer. And this was pretty consistent with what's seen in most of the career firefighter cohorts as well, the exception being that enormous prostate cancer number in the Australian firefighters, as well as their melanoma of the skin, probably related to sun exposure. They're near the equator. But what do you notice about these cancers? From what we've learned over the past couple of days, these are all very amenable to screening programs. Prostate cancer in particular, lung if you're doing CT screening, but certainly melanoma, colon cancer, and bladder cancer with a simple urinalysis. All of these are very detectable with screening tests, and we know that the probability of survival, 5-year survival, is so high for these cancers if you catch them early versus later. Almost 100% if you catch the prostate cancer, the melanoma, colon cancer at an early stage. Among the women in our study, the most common cancers were what we would expect based on the population rates: breast cancer, melanoma of the skin, and colon cancer. And again, and cervical cancer was there as well. All of these are amenable to screening, detectable with early screening tests at a stage when treatment is most effective. So that's the good news. I bring up this thesis, which was done by one of you guys. This is a battalion chief, recently promoted battalion chief, John Hasney from FDNY. I'm using this with his permission. He did his master's thesis in Homeland Security and Defense at the Naval Academy. And I love his graphic. We've been talking all the last couple of days about how we can change best practices that we learn about in these meetings and implement them at our local level. And you could write a thesis on each of these barriers, and people have, but he analyzed, he did 2 case studies. He analyzed the literature on barriers to why do firefighters make good or bad decisions. There's very positive attitudes towards cleaning your gear, for early detection, participating in physicals, but what actually happens back at the fire companies or after a fire scene. And he identified these 7 barriers, and these are equally impacting both volunteer companies and career firefighters, maybe somewhat differently. They're, through our research and some of the other work, and I'm sure Judith is doing some work with her volunteer study, the issues of groupthink and the culture within the volunteer company, that they have this altruism. They're not getting paid to do this. This is their community that they're protecting. And that's true for all firefighters, but in particular, this is the type of individual will that they have to be doing this work. There's a warning. The first quote is a warning that this is what's happened over the years, unnecessary exposures. But the good news is that with proper tools, training, education, and awareness, fire companies do rise to the occasion and implement the best practices to prevent occupational cancer. And he did a deep dive on 2 programs, including the Palm Beach County FACE program in collaboration with University of Miami, as well as the FDNY program, which I'm blanking on the name. It is Reduce Your Risk. There's so many great programs. University of Washington has an amazing program, and their information is all available. Healthy In, Healthy Out, but he did a deep dive on these 2 collaborations, and he was a founding member of the working group at FDNY to develop Reduce Your Risk. So he does a lot. It's available online. Just Google his name and thesis, and there's a lot of great information on practical ways to implement the best practices. As I mentioned, individual will, that was of the factors he outlined, one of the main things that can change behavior. Organizational solidarity is the other one, and we'll get to that in a minute. But for individual volunteer firefighters, and I'm preaching to the choir, anyone that's here is already aware of these things, but for our volunteer community, the Lavender Ribbon Report was written for firefighters by firefighters, and it really does, and the update goes through a lot of practical applications to implementing best practices in your department, including costs and additional resources that might be needed. This is a big challenge in the volunteer fire service, but individuals can take their own future in hand. Participate. If you don't have regularly scheduled physical exams, maybe it's something that you can bring up for your department and at least let your primary care provider know you're a firefighter. And then, as we recommend, follow the screening guidelines for your age and gender. Early detection is the key to survival. And again, in terms of the organizational commitment, I could have put motivate as well, only 8 words, but educate. The Hasney thesis found out the 3 main themes to success that he identified were education and safety programs, updated regularly and held frequently, so that there's an awareness throughout the fire department, a sense of urgency, not fake urgency that we're all going to die of cancer, but true urgency, as people have said, this is the time to attack these issues now. The other was in a dedication of the leadership to bringing in experts and dedicating resources for these types of training for the recommended PPE and decontamination supplies and advanced cleaning of the gear regularly scheduled. His example of FDNY, there was a decontamination service unit available. No one knew about it. It was so underutilized. They would sit there week in and week out without any gear. So they started doing an educational campaign where they sent out over the machine, I forget what it's called, to every station, there were people sitting there waiting to pick up your gear, do the advanced cleaning, and deliver it back to you in less than 48 hours. In addition to the education about that, that was more of a practical solution, they did a huge social media campaign. And that's where even volunteer fire companies can engage your younger members in spreading the word through the types of social media messages that get a lot of traffic. And they started blasting all the Facebook, Instagram, and other methods that they use to let them know about changes in culture. Salty is out, clean is the new salty, and all of those messages. And they saw 514% increase in gear cleaning in the first month. It did level off, so they've been sending out reminders after every second alarm that everybody should have their gear sent to the rehab unit. And then the social media hits was another type of data that they followed to see what was a successful public service announcement in terms of the best practices. And then my last thing is a plea to participate in research. And again, preaching to the choir, we're very excited that the NFR is coming on board in terms of over-inclusion of the volunteers and other underserved populations. But keeping accurate records at your fire department was the major deterrent for fire companies participating in our research. They wanted to, but they just didn't have either the records in a computer personnel management software that would have helped them, or the staff to do it. So again, if you can assign, some probie to set up your management software and keep the records up to date, it does help, and then perhaps participate in the NFR as an organization. So that is it. Just acknowledging the FASNY organization as well as the New York State Office of Fire Prevention and Control, which helped us get our recruitment tracking database, and Tim Graves from that organization was here. He's been a huge help in some of our recent work, and the FASNY organization, including Brian McQueen, our hero. So that's it. I think Dr. Moline is available if there's any questions as well. I think she was going to try to. Thank you. There she is. She is there. Yeah.
Any questions for Dr. Moline and Dr. Golden on volunteer firefighters? And I just want to do a proper introduction for Dr. Golden, since there is a little bit of a switch. But Dr. Golden is an associate investigator at the Institute of Health Systems Science, Feinstein Institutes for Medical Research. She's an epidemiologist who joined the Faculty of Occupational Medicine, Epidemiology, and Prevention in 2016, and more than 20 years on the faculty of the Department of Prevention Medicine. Her primary research interests have been carcinogenic, reproductive, and developmental effects of occupational and environmental exposures, and the development of methods applicable to studying these issues. Thank you so much for presenting. So our next subgroup are our fire investigators, and to present today, we're going to have Jeff Pauley, a nationally recognized expert on fire investigator and post-fire scene health and safety. Jeff Pauley is a partner and fire group manager with Pacific Point Consulting, where he provides corporate training, support, and policy development assistance regarding the post-fire environment. He also works part-time as a fire investigator for EFI Global and has been a member of the IAAI Health and Safety Committee since it was established in 2016. Please join me in welcoming Jeff Pauley.
Thank you for not reading all of that.
Yeah.
15 minutes later. All right. I appreciate that she didn't read everything. It's in the book. You guys can read it, right? Okay. I will try and figure this out. So here in the United States, fire investigators are what I believe is an underserved population. You heard Kenny Fent refer earlier, and we've heard it before, somewhere around 1.1 million firefighters, career and volunteer in the United States. There are no accurate numbers because there's no one data point data source, but just a few thousand at best public fire investigators. There are also a few thousand private fire investigators, and some do both. The problem is that we are relatively ignored within the fire service. And I'm going to give you a quick story for that. I spoke to a public fire investigator, and a lot of them were dual roles. Some are busy enough that they don't. But this gentleman was what we affectionately refer to as an inspectigator, right? He goes out and does fire inspections, and when there's a fire, he may be going and doing that. He comes from a very good municipal department, and when I say good, what I mean is that they issue 2 sets of gear to the firefighters, they do the switch out, the particulate hoods, all the good stuff. The 3 fire investigators went to the chief and said, hey, we'd like to have SCBA because we're in these scenes right after they're extinguished. We don't have any money for that. That happens all over the place. Many of you probably have fire investigators within your agencies. So I would challenge you to examine how they are being treated. And we're working hard to try and do that. So the challenge is, and I loved the stat that I think Kenny used a little while ago, 1 to 5% of a firefighter's time is consumed with fire suppression. Unfortunately, fire investigators go to many more fires than firefighters. Oftentimes, as was alluded to, you're going over a shift from fire to fire to fire. We spend a lot more time at those scenes. A simple scene is probably an hour, unless you're pressed to go somewhere else. A more complex scene can be many hours or several days. But unfortunately, with all of that, they are less well prepared. And why is that? We divide, on time base, we divide fires into 4 types. We define a cold fire scene as one that's been out for at least 72 hours and there's no visible gases, particulates, et cetera. Several problems with that from the PPE perspective. The first problem is, as the 2010 UL study showed, over 97% of the particulates during overhaul are too small to be seen. If any of you guys and girls know Pete Manzi, Pete was with, he's my co-chairman, by the way, and he knows I tell this story. He's retired fire investigation lead for London Fire Brigade. He said, before I was smart, I'd go to the fire scene, I'd open the door, I'd shine my flashlight down the hallway. If I didn't see any particulates, no problem, no PPE needed. That cannot be further from the truth. We need to have our fire investigators educated, and we're working on that, but it's an uphill battle, and they need to be wearing the proper PPE. So in order to address this big problem, the IAAI, International Association of Arson Investigators, over 10,400, whatever, 500 members worldwide, big group, right? We recreated a health and safety committee in 2016. It had been around years before and went away. We started looking at this, we started wondering, how can we deal with this, right? So in 2018, we released the first edition, mere 16 pages, but we had to draw a line in the sand of fire investigator health and safety best practices. It was a place that we started. It was a simple Microsoft Word document, no pictures, no graphics, no nothing. In 2018, we took that even further with a second edition that went up to about 40 pages or so, and it was really good. The difference between what we do in our world, NFPA 921, which is the guide to fire investigation work, is the Bible. But as you all know, it's a consensus document. It's only out every 3 or so years. What we do is easier, quicker, better to get out. I'm not into reading slides to people, so you could see what some of the other problems were up there, right? So we're now on the cusp of the third edition. It's gone up to 60-plus pages. The beauty of this is not like, Natasha and I or Alberto and I, we got a good idea, and we're going to put all this stuff out there, and if you agree with it, fine. If not, whatever. It's peer-reviewed, it's technical reviewed, it's administratively reviewed. It is not a consensus document. It is a best practice regarding the science of the post-fire environment. And I will tell you, the more I learn about it, and it's been a lot over the last few years, the scarier it is. And if you're not adequately protecting your fire investigators, there's going to be a problem down the road. Unfortunately, they'll probably be retired after that. And one of the challenges that we run into is a lot of the public fire investigators, they start off on an engine or a truck company, right? And they spend some time there, so there's some exposures. Well, then they transfer into fire investigations for a while, and there's arguably a lot more exposures. Well, maybe they get promoted into something else. It's hard to track and point back when you develop that cancer 30 years later to what the exact cause was. So it's very challenging. Once we're done with the paper, it's not really paper anymore, it's more of a document. It's almost a book, right? It's 60-plus pages. Our Training and Education Committee reviews it. Our Executive Board reviews it. There are a lot of eyes. There are people in this room who have contributed to the review and technical review of that and many others. And in each document, you can see a list of all of those people. We have got the latest research there. My friends at Underwriters Laboratories did some great work that was published last December that shows the magnitude of the problem post-fire out 5 days. The first study ever out 5 days post-fire. Gases, particulates, good stuff. You see a link here. This third edition is in final review. First one where we've had a actual professional graphic artist design the cover, which was nice. But this link here, IAAI-whitepaper.com, you do not have to be a member of our fine organization. Anybody can use this hot link to get to the research material that we have available. And currently, the second edition is there. It's nice, it's great, but if you wait a few weeks, the third edition is going to be there. The reason for that hard date is that our international training conference up the street in Jacksonville, a few miles, right, is this coming April, and we've got an entire day devoted to a whole track, 4 sessions on fire investigator health and safety. So real excited about that. Yep, let's try that. Okay. Maybe it helps if you push the right button, whatever. So here are just some of the highlights on what's new and different and makes this really a first-rate document. I'm not going to read it all to you, but there's a lot of new stuff, new added stuff in addition to the research, because we are continually striving to make this the best possible. I have already started notes for the 4th edition, whenever that is, because it's a constantly evolving area of knowledge and interest. And when we know better, we have to do better, right? So there's notes from stuff from yesterday and today that will likely end up into the next edition. One of the things that we have done a lot with, though, we have added some testimonials, and I put one of them up here that you can all read, because it should strike home to a lot of us here in this room, because this fine gentleman spent a lot of years as a paid firefighter, as a volunteer firefighter, and a fire investigator, both public and private. And he was kind enough to share his testimonial. There are 4 altogether that we've crammed into this. 2 are from cancer patients. I will tell you that one of the 2 is a survivor, the other is not. But we were able to get information and a very powerful video from him a couple years ago to use for our training. And so the testimonial in the Best Practices 3rd edition is excerpts from his about 10-minute presentation. Very moving. I've also got one from an injured investigator where a section of wall fell on him, and one with PTSD. Very powerful stories, trying to make it personal and get in front of everybody. So I was only given a few minutes. I could talk for hours on this subject, right? But I will tell you that we do offer training on this very important subject. So if you have a fire investigator group in your area, or you have folks in your agency that you would like to be a little more aware of this, and I didn't think to put it up on the slide because I probably did it in the morning before coffee or whatever, but IAAItraining.com lists all of our stuff. The health and safety course is listed there. We could tailor it for you guys. We typically like to do 3 or 4 hours. We can really dig deep in and do into a bunch of OSHA and fun stuff like that, up to 8 hours. So at any rate, underserved population, looking for some champions, right? Besides the few of us to support better health and safety for fire investigators. Thank you.
All right, thank you so much. Does anyone have any questions? No questions. Okay, thank you guys so much.
Thanks.